Hello and welcome to the Encephalitis Podcast, or perhaps because of our guest today, I should say Encephalitis Podcast. I might dip in and out between the two. We'll see how we go. But in this episode of the Encephalitis Podcast, I'm really delighted to be joined by Dr James Sejvar for a discussion around climate change and how it's affecting our risk for deadly infectious diseases such as West Nile encephalitis or Japanese encephalitis, just to name two among many. James, or perhaps Jim as he's better known, is a neurologist and epidemiologist at the Centers for Disease Control and Prevention in Atlanta in the United States of America. His work focuses on epidemiology, pathogenesis, clinical features, and outcomes of infections of the nervous system, work which has taken him all over the world. He has investigated the West Nile virus in the United States, Ebola in Central Africa, Zika in South America, and of course, COVID-19. So he's very well versed on this topic. But perhaps his most important role is he is one of the newest recruits to the Encephalitis Society's Scientific Advisory Panel. Welcome to the Encephalitis Podcast, Jim.
Thank you, Ava. It's great to be here.
Well, I'm going to start, as we say, at the beginning. Can you tell us a little bit about your work with the Centers for Disease Control and Prevention, or the CDC, as it's more commonly known in the United States?
Sure. So as you kind of mentioned, I'm trained as a neurologist with a focus on epidemiology and infectious diseases. And so my work focuses on outbreak investigations and research into the clinical manifestations and outcomes of nervous system infections, but also other public health events surrounding neurologic disease, such as toxic exposures and issues related to vaccines.
Well, you've, as you've described, had your boots on the ground in the USA as well as in other countries looking at infectious diseases. Is there anything that you're working on at the moment that you're able to tell us about?
Well, as you can probably imagine, a lot of the past couple of years has been very busy with COVID. Most of my work over the past couple of years is focused on the neurologic manifestations and cognitive outcomes of COVID infection. So have several projects underway looking at the neurologic manifestations of acute SARS-CoV-2 infection, as well as sort of the longer term outcomes of COVID infection, including neurologic and neurocognitive outcomes, what's oftentimes referred to as kind of long COVID.
I think we had this podcast scheduled, didn't we? And you had to, were you running off to South America to investigate an outbreak of Guillain-Barré syndrome? What was that related to COVID or something quite separate?
We don't think that it was related to COVID. At this point, we're not sure. There have been at least two outbreaks of Guillain-Barré syndrome, which is an immune-mediated peripheral nerve disease of the nervous system. That's typically triggered by an infectious disease of some type. This occurred in Peru, and so CDC, along with other partners, had been assisting the Peru Ministry of Health in investigating the cause and the outcomes of these Guillain-Barré syndrome cases. At this point, we're still not sure what the actual cause is or was, but we're still working to try to investigate and identify that.
Well, look, the big question, Jim, can you describe for us this concept that we're hearing more about called One Health, and explain if this and climate change are leading to a rise in the spread of new and emerging infectious diseases that may indeed threaten human health? You know, what's that all about? What are the core aspects? What do we need to understand?
Well, the concept of One Health has been around for a while. It's this idea that humans and animals and the environment are all kind of interconnected, if you will. And there's a strong interplay between these three areas of the triangle, if you will, that influence health and conversely disease. And there have been a number of very poignant examples of animal health directly having an impact on human health. Just recently with the pandemic, with the recent outbreaks of Ebola that we've seen in Central Africa, and so there's this idea that there's a great interplay between animals, humans, and the environment that directly impacts health, and that's basically the concept of One Health.
And how does climate change sit with that concept then? What's happening with climate change, and how is that impacting the way infections and infectious disease is behaving?
So that's a really good question. And within the concept of One Health is this idea that our impact on the environment has a direct impact on disease and on human health. And this is just very well illustrated by a number of different factors that are occurring on a global scale. Increase in population density, the migration of people between rural and urban environments, changes in the way that we process our food and water. All of these things are One Health concepts that lead into impacts on human health. And sort of within this concept is the idea that changes that we are impacting on our climate can also impact human disease as well as animal disease. So it's not quite as simple as saying because we have climate change and global warming, we're having increases in disease. But certainly the impacts that we have on the climate and on the environment, in many cases, may be directly or indirectly contributing to increases in various infectious diseases.
Are we already seeing infectious diseases in areas where they have typically never been found before? I mean, you mentioned Zika earlier, and I think that's one example. And to my mind, I quickly recall we did quite a bit of work when there was the outbreak of Japanese encephalitis in Australia, which I think started in kind of February, March 2022, I think. Are we seeing more of this, and are there any other examples?
Yeah, this is really good points, and just kind of starting with that example that you gave about Japanese encephalitis. I'll say encephalitis in Australia, where prior to 2021. You could literally count on one hand the number of indigenous Japanese encephalitis transmissions there had been in Northern Australia. But starting in, as you mentioned, kind of early 2022, there was a sharp increase in the number of indigenous JE transmissions and human infections, not just in Northern Australia, but also spreading sort of further south. And it's thought that changes in climate as well as rain precipitation factors led to the kind of the spread or the increase in the geographic distribution of Culex trichogenitorhynchus, which is the mosquito that transmits Japanese encephalitis. So that's one very recent and very poignant example of how climate change may be influencing the distribution of etiologies of encephalitis. As you mentioned, Zika was another good example of a neurotropic pathogen that previously we really hadn't seen outside of Africa or in some cases the South Pacific, which suddenly and unexpectedly spread throughout much of South America and into North America, and in some cases in Europe as well. So those are some examples. One, as you kind of mentioned earlier on, one of the diseases that I worked on very early in my career was West Nile virus, which prior to 1999 had only caused occasional outbreaks of encephalitis and neurologic disease in Africa, some parts of Southern Europe. But in 1999, kind of suddenly and unexpectedly showed up in North America, leading to large outbreaks of encephalitic disease. We're not really sure how West Nile actually kind of made it to North America, but it's fairly likely that changes in inflammatory patterns and whatnot played a role in the sort of the ongoing distribution and spread of West Nile virus throughout North America and Europe.
And these diseases seem, when they or the vectors that transmit them migrate to new communities, they seem in many kind of occasions to be having really profound effects on these communities that have not experienced these diseases before. Why is that? Why would it have a greater impact in those communities where it hadn't existed before?
Yeah, that's another excellent question, and there's probably a couple of different reasons for that. Oftentimes, when a new pathogen or infectious agent is introduced into a new population that hasn't previously had experience with that pathogen, there's not a lot of what we call background immunity to that pathogen. For many infectious diseases, when we're little, we kind of get exposed to kind of low levels of an infectious agent, and we kind of build up an immunity. But sometimes when a pathogen is newly introduced into a community, there's none of that background immunity, and so it can lead to more severe disease, particularly in older people. Another possible reason that is kind of related to climate change is the fact that warmer temperatures in some cases seem to alter the human immune response to some extent. And there's some theories that perhaps global warming as an entity may sort of play a role in sort of more severe outcomes from an infectious pathogen.
Wow, I didn't know that. That's gonna be my Google homework. That's really interesting. Obviously, we're very interested in encephalitis. Are there any specific causes of encephalitis that you think are likely to become more prevalent as a result of what we've been talking about?
Well, the big sort of epidemic cause of encephalitis globally, and a very big concern is as we've mentioned several times, Japanese encephalitis. And right now, it mainly occurs in South and Southeast Asia because of the distribution of the mosquito vector or agent that spreads the virus. But as has been sort of evidenced by the experience in Australia, it does appear that there might be an increasing spread in the distribution of Japanese encephalitis, sort of outside of that endemic zone. Another etiology of in some cases encephalitis that can occur is through another virus that's actually related to Japanese encephalitis called dengue virus, and again probably related to changes that we've affected on the climate as well as precipitation factors. There's been a kind of an increasing spread in the geographic distribution of the mosquitoes that carry dengue. And so it may be that we start seeing increasing cases of dengue encephalitis in certain areas, particularly in North America. Finally, another agent that sort of comes to mind is, although there's some question as to whether it causes an encephalitis versus an encephalopathy is malaria. And again, because it's a vector-borne infectious disease, there may be situations in which the geographic spread of malaria increases, and we could see cases of malaria encephalopathy, encephalitis increasing.
I noticed in that you didn't mention Nipah at all. Is Nipah virus something that we should be concerned about? I mean, we hear about it periodically, these kind of mini outbreaks that don't seem to spread too far, but that seems to be increasing.
Yeah, that's a really good point. And Nipah, which is a paramyxovirus that has caused repeated outbreaks, particularly in Bangladesh and in some cases parts of India. This is another zoonotic disease, or related to that One Health concept, where bats that are the natural reservoir, the natural host for Nipah, spread the disease to humans through a number of different mechanisms. Fortunately, at this point, most of the Nipah outbreaks that we've seen have been kind of geographically situated in northern Bangladesh. But as we've seen with a number of different pathogens in the past several years, geographic spread of Nipah outside of that area is definitely a cause for concern, and something that there's active surveillance to sort of monitor.
What are organizations like the CDC and the World Health Organization doing to tackle the emergence of these infectious diseases?
Yeah, that's a really good question as well. And particularly from the standpoint of addressing One Health issues as they relate to infectious diseases in general and encephalitis in particular, CDC, World Health Organization are using kind of a think globally, act locally sort of approach, where doing surveillance and monitoring for the emergence of various infectious diseases is very important. And we do that in collaboration with where the pathogens are. So we at CDC, as well as the World Health Organization, partner with ministries of health of various countries where some of these pathogens are sort of originating, and work to try and monitor the occurrence and the geographic spread of pathogens. And this is an interest to help prevent the spread of these pathogens locally, but then also, as we've kind of seen again, in various examples, an infectious disease that's originating somewhere in central Mongolia can definitely have impacts on human health in the UK or the United States. And so it's in the interest of the of various countries to address global infectious diseases as they originate locally.
Well, there's some reassurance there. I mean, take us into, at the risk of taking us into, I should say, slightly controversial territories. Do you think that people who deny the existence of climate change and vaccine hesitancy movements, which in my opinion, I think we've seen more of, I kind of thought that the COVID-19 pandemic might reduce that, but actually I don't. I think I personally saw a lot more of it, and I think many colleagues would agree. But do you think people that deny climate change and people who are hesitant about vaccination, do you think that they're at risk of worsening some of the situations that we've been talking about today?
Yeah, really good point, Ava. And I think that the sort of the climate change denying and sort of the anti-vaccine movement is a symptom of a kind of a larger sort of anti-science sentiment that seems to have been growing over the past several years, that really kind of seemed to be exacerbated during the pandemic. There are probably a lot of different reasons for this. it doesn't help when leaders have a kind of an anti-science bent, because that can kind of result in sort of a trickle down effect on people's thinking. There's a lot of different sort of moving parts to this, obviously, but certainly when people vehemently deny human impact on climate, that does have impacts on stymieing efforts to sort of address issues related to climate change, and so that can be a problem. From the vaccine standpoint, it's repeatedly become a big problem, both in the United States and the UK and the rest of Europe, where in any individual case, that there are legitimate reasons to forego vaccines in certain individual cases, but when large populations sort of have that mindset, that undermines public health for all of us, and we've begun seeing the return of what were previously considered kind of extinct or dead diseases, because of this hesitancy around vaccines. And so a lot of sort of public health efforts, both from CDC and ECDC, is focused on education and trying to inform people of the benefits of vaccines as they relate to greatly outweighing any risks that might be there.
Yeah, absolutely. I agree. Education has got to be critical. The right information, trusted information, and also the delivery of that information by trusted partners. As you say, sometimes curveballs can be thrown when you have leaders of countries who are clearly helping spread misinformation. So I think you're right. Education and trusted information, and very important. So I'm getting to my last couple of questions. You're probably breathing a sigh of relief. Thank goodness this is nearly over. I'm sure you're not. But is there anything that listeners to this podcast or viewers to this podcast can do to address some of the topics that we've covered today? Is there anything people can do?
Yeah, that's always the sort of the $1 million issue, isn't it? What can I do? And with concepts that are as kind of widespread and large as climate change, it may feel like whatever drop in the bucket that I do as an individual isn't really going to make an impact, but in reality, if we all started, paying close attention to our carbon, the carbon footprint or other impacts that humans have on things that are contributing to climate change, that's going to make an impact. Driving electric vehicles or recycling, these things that seem very simplistic but are in totality are very significant in terms of making an impact. And then also just advocacy, people speaking to their leaders and sort of pushing for governments to initiate and enact the changes and the things that are going to make an impact from a global standpoint. So there's really quite a bit that people can do on an individual level.
Yeah, I think that's really important, a really important takeaway message from this podcast. We can all be doing our bit. But I will finish, as I always do in these podcasts, by asking you if there's anything that you wished that I'd asked you today, or if there's anything else that you want to add before we bring the podcast to a close.
Well, I've really enjoyed this chance to kind of speak to this issue of climate change and its impact on infectious diseases and particularly encephalitis. And so, to your listeners, I just really, again, kind of go back to the message of there's a lot that can be done as on an individual basis to address these issues surrounding climate change and whatnot. So thank you.
Well, thanks. Thank you so much. I'm very excited because I know I'm actually going to be seeing you in person next week at our global conference. So we're super excited. Bigger numbers than ever, both in numbers of people in attendance and countries in attendance. So it's going to be the biggest one yet. And you are one of our keynote speakers, so we're absolutely delighted. So thank you so much for joining us on this Encephalitis podcast today, Jim. For the people who are listening at home, don't forget the Encephalitis Society remains at your service. And so if you need any support or information, our teams are there for you. Go to encephalitis.info for contact details or to chat to one of the team online. We hope you've enjoyed this podcast. And as always, if you can support our life-saving work, we would be extremely grateful. Perhaps now more than ever, please visit encephalitis.info/donate and try and do your own little bit towards addressing climate change if you can. Thank you, everybody, and goodbye.